With those hungry eyes?
Yeah.
Does your dog do that too? Mine too.
Maybe a little bit later.
What about staff?
Okay, we'd like to call to,
Nobody wants it.
call to order the combination finance and personnel joint meeting for March 15th. It is 6:38. First on the agenda, any public participation? Seeing none. Seeing none, moving on. New and unfinished business, 3A, ARPA funds discussion.
Okay, so I tried to think about when we had the last conversation, and it's been months. At the last conversation, you had asked us to go back and survey staff. So we held 4 in-person meetings to talk about ARPA, get staff input, hear their ideas. Then the executive leadership, we all sat down, went through it, and are bringing forward the projects that we think are most eligible, that we'd like to see pushed forward. But keep in mind that this process isn't really black and white. It's pretty nuanced. So I think for tonight, what we'd like to happen is just essentially approval to move these projects forward, but with this recognition that it is nuanced, and I'm going to get into that because it's going to take approval at kind of several levels to move these projects forward, to meet the eligibility use tests, to run it through the Bronner Group, which is the consulting firm. So I just, that's sort of like the caveat here, or the qualifier. And we have sat down with the county, and we have met with the Bronner Group, which is that consulting firm who has been hired to vet these projects, to review them, see if they, and review them for risk, and I'll talk a little bit about that. So in terms of ARPA, it was signed into law on March 11th of 2021, and then the final rules came out last April with a companion document. And we didn't include this whole document, but we included part of it, compliance and reporting guidelines, which provides an overview of the federal 100-page CFR document. And so it's just commonly referred to as the State and Local Fiscal Recovery Funds Program, the SLFRF. And the overarching purpose is to respond to the economic and public health impacts of COVID. And the timeline is, which we've talked about before, so all the funds have to be obligated by December 31st, 2024, and spent by 2026.
And all of these projects are, meet the standards of
Well,
this?
so we think so, but that's what I'm saying, is it really needs to be vetted through the Bronner Group first, and then they vetted the first round, like we sent over our ideas to them. They gave comments and said, well, you're going to need more detail. Today we actually received a document that we hadn't received before that's going to dig a little deeper. So I think that'll be one of the next steps, is to complete that document for them for our projects, and then have them respond to that. From there, then it would just keep moving forward. But what we're looking for here today is a general, do you think the concepts of what we're presenting make sense? And then we'll get into what happens if they say, this is too high risk and we're not, they wouldn't recommend it. So these eligible use categories, there are 4 overarching eligible use categories in the guidance. So public health, so it's responding to the COVID-19 public health emergency or its negative economic impacts, responding to workers performing essential work during COVID-19 public health emergency by providing premium pay, which is something that we have already accomplished. Government services and revenue loss. This is one I can't explain very well, but it's really more on the county side, accounting for there's a formula by which the county can recoup revenue losses that took place during the pandemic. And then necessary investments in water, sewer, and broadband. So those are the 4 sort of top-level things that everything rolls up under. Then there are these 7 expenditure categories, and that was one of the things that was included in your packet that laid out expenditure categories. There are enumerated uses that fall under that, and those are just sort of clear and apparent. If it meets this test, it's approved. And then there are non-enumerated uses, and that's where it gets a little more nuanced. So regardless of the category, there has to be a strong link between the proposed project and the way the document reads is a harm caused by COVID-19. And then the response or the project that you're proposing needs to be reasonable and proportional. And again, I don't know that we can necessarily make that call, but these are the tests that each of these projects has to meet at the federal level. Otherwise, potentially you could move a project forward, and if they audit it and say it doesn't meet the test, then the county would have to pay those, would be obligated to pay those funds back. So it's really important that we get it right on the front end and reduce that risk as much as possible. So public health, this first one is the impacts of COVID-19 and the emergency itself, including, they've included things like community violence interventions and behavioral health under there. Negative economic households is really targeting households, could be affordable housing, job training, childcare, aid to small business, nonprofits. And as you'll see, there are some tests about populations that are impacted and disproportionately impacted. You have the premium pay, oh, I'm sorry, I skipped one, negative economic, public health and negative economic impact, public sector capacity. So this is a separate, really looking more at the public sector itself, the workforce, the capacity of the workforce,
If you
public
need
sector
plates,
payroll.
I think there are some there.
There's rehiring in here of public sector workers. So if anybody had to be laid off during the pandemic, this is an allowable expense to rehire folks and build up that public sector capacity. Then the water sewer infrastructure projects, the revenue replacement, and then administrative, which is an area that I'm still a little fuzzy on. Oops, excuse me. But I believe the way some of the examples in the document are hiring a consulting firm to manage this process, and I believe that falls under that administrative piece. So, within the county, this is a general process that, how did I do that? I use my trackpad and it is very sensitive. So, working with the county consultants, the Bronner Group, they would review our project proposals and assess that risk. So they're going to be looking for our projects to meet the eligible use criteria. Again, that demonstrated harm, the proportional response. Certain categories are required to show a population impact, or that a population was disproportionately impacted by the pandemic. We have to, so from there, it meets that test. Then we can create, we wouldn't create it, but the county would create a project budget in D365. So we would give them our budget, lay out what that looks like, create the budget, and then as part of that process, and these might be slightly out of order, depending on how things actually play out, but we would have to, anything over $30,000, we have to comply with the purchasing ordinance, so we'd have to go out for bid, get RFPs. And then the guidance requires, or the law requires that there's quarterly reporting by the county. Any questions so far?
Find it interesting, despite through all that. I've looked through these different categories. They're so specific about it has to be pandemic affected. Like in some of these, I can kind of get there. Like even like behavioral health, and we know this has had an effect on people's minds, and violence, and is okay. But then like water, sewer, and broadband, how is that? Like I feel like I'm missing something there. That someone.
Well, if during the there's so many kids who maybe didn't have internet at home,
And that costs, the county had to, like, they had to buy everyone those VPN,
All right, and they were
those-
doing hotspots on buses, okay.
Right.
Right,
All right, that
so-
helped me,
Mhm.
then
Yeah.
water and sewer.
So they were, so kids may have missed more school, fell behind, right? So those things get connected, and if I have time, I'll go look it back up. But there is something about, specific, if anybody back there has time. But it does reference more information in the full document about water, access to clean water, drinking water.
maybe-
But I see your
yeah.
point about,
Or if like maybe those projects were put on hold because of the pandemic, you couldn't go in there and, people working close. That's my
Maybe.
guess.
Yeah, I was just thinking like, not so probably something that we would utilize unless our employees are looking for a bottled water station or something.
we'll
but-
just wait, we'll get there.
Cool, I'm excited.
Okay, so this is just a very high level of the projects we're proposing. So P1 means like priority 1, priority 2. We have a column for things that have been expended or obligated. And then we have a non-ARPA column. So right now, we're proposing, and these are sort of my categories. They don't necessarily exactly match the categories in the document, because I just want you to get a general sense. We're talking about capacity projects, and we're talking about potential capital projects, environmental health projects. The negative impacts, just so that it would fit on the slide, we're talking about negative health impacts, so we're really talking about our community health improvement project, priorities there, technology upgrades and infrastructure, and then workforce and staffing.
So capacity is the ability to bring in, to handle more client needs?
It's that, and it's also potentially improving on some of our processes to better serve the public,
Okay.
so that they don't have to come in for services.
Okay, and then, pardon me, column 3, forgive me, is EXP.
So we have already expended some of these funds.
Obligated or something?
Yeah, and
Thank you.
I just had, I
I'm sorry,
shorted it.
I missed that.
And by obligated, I mean, so the expended ones are things like in that first row, capacity, again, I dropped it into capacity there. That was our consulting project with ISC. So that's already been expended. The $25,000 in technology is the digital sign in Crystal Lake. Then we have 2 positions that have already been approved, an informaticist and a nurse. And then one of the resolutions tonight is proposing a 3rd position for an accounting assistant in health administration. So that's where those funds are obligated out to 2026. Then the non-ARPA stuff is that workforce is clearly a priority for us. However, we have some funding from IDPH right now that we've been using for training and some workforce development. And then there's another block of money that's going to be coming, that's coming down from the CDC to IDPH, that every certified local health department is going to get. It is a 5-year grant, and it is going to be for workforce retention, capacity, all around staffing. And that's, just under $70,000 for 5 years. But you'll see from this, hopefully, that, so if you recall, we have $7.5 million fenced off, but we're at 7.6 with our ideas. So obviously, we have more ideas than what has been carved out, but these costs are just estimates right now. So again, I kind of covered this on the previous slide, the integrated solutions consulting, the premium and bilingual pay. Premium has already happened, bilingual pay is slated to get approved, hopefully through the county board next Tuesday, the digital sign, and then the staffing. So when we start talking about the priority projects that we have laid out, the negative impacts, we're talking about, again, on our community health improvement plan, we have behavioral health as a priority. We have diabetes as a priority. We have access to care as a priority. So these are things that were exacerbated by the pandemic, and we feel like that's a legitimate request. Within that is, for example, a mobile clinic, getting a rig an RV van, you know, a van that's essentially built out so that we can provide mobile clinics and go to target populations. So this would help reach disproportionate populations out in the community. And we saw that during COVID. Capital expenses. So we're proposing to make some changes to the Crystal Lake facility, as well as we have a storage facility out near DOT. Well, not we, the county has a storage facility, and we occupy a portion of that. We have struggled to find a permanent home for our PPE, and we have been managing the county stock of PPE. Susan, jump in if I say it wrong. All those COVID PPE supplies that we got, we have been managing those. They have had to move these supplies around many, many times because there are a lot of them. So the Nelson storage that's out there could be reconfigured, we believe, to accommodate that storage. And because during COVID, it's in the building where the records are kept, so the long-term record storage. They moved a lot of their stuff, digitized them, those records, so they need less space. So that provides an opportunity for us to expand that space, but potentially modify the building so that when we're distributing supplies, a truck could pull up, which would require cutting a hole in the building, you know, putting a door and probably an overhang there to accommodate that. Also with Crystal Lake, you know, could be upgrading the ventilation. We're still waiting for clarification on the capital plan and whether or not that's going to be covered there, or is that something we can cover. Ventilation is something that is clear in the guidelines, but we have talked about potentially putting an emergency operations center there, building that out, possibly moving the clinic out to a co-located service, co-located area where we could work with community partners. That gets into the next one, you know, integration of services and co-locating potentially primary care, behavioral health, and public health together to better serve those targeted communities and vulnerable populations. Then the technology upgrades, and we're calling this just generally infrastructure upgrades. The guidance allows, again, for us to build up or upgrade our technology so that we can better serve customers. So, for example, an inventory system that we could track all of our PPE and just scan it, right? And know what we need, when we need it, and automatically potentially reorder. That saves staff time when we have to deploy staff during an emergency. You know, they can refocus when there's more automation built in. Point of sale system, same thing. It's very, we don't have one. So when I say it's very antiquated, you know, we're using spreadsheets and feel like we can better serve the population if we had a system that migrates that information into the systems we already use, so we're not having to tally these things by hand. Then we talked about the EOC for emergency preparedness and ER. So that would be like an expansion. We do have some of that capability over in Building A. We could also use the funds for dashboards. So the guidance is very clear about data, so effective service delivery, data, communications. The Bluebeam is a technology or a software for planning and permit reviews, correct, Patty?
Correct.
Okay, so that would allow them to electronically exchange information, and customers, or in this case, I guess, contractors, Patty, primarily,
And designers.
wouldn't have to physically come into the building. And our staff could also work remotely when necessary. Then, so the water, you know, when we were talking about that. So
Yeah, there's
from
a whole page 16 about it, I've just been.
from a capacity standpoint, so during the pandemic, access to some of those private lab services were difficult. They couldn't get supplies. It the supply chain was disrupted. So by moving in the direction of expanding our services to be a certified lab, it expands our ability to do more drinking water testing. And in talking with the consultants, it sounds like that is an eligible, potentially eligible expense. And then there's also the ability to spend on consulting, website, communication support, right? Because communications, again, was a big part of the pandemic, and having support to do those things are all, we feel like, relevant projects, areas where potentially we have struggled that we want to build our capacity for that. So the other funding, again, for workforce and staffing, we have that non-competitive money that's going to come from the state in about $348,000, and then we still have crisis grant money. Fortunately, that grant just got extended, and it's possible that there could be other funding after that. But anything where there's another funding source, we're going to want to do those projects there, right, and not on ARPA. So this can include hiring, and hiring could include placement of ads, right? It will cover ads targeting, universities or recent graduates, website ads, that kind of thing, or other potential recruitment and retention ideas that fit the grant, and we haven't seen it yet. But mental health, social and emotional things to support our staff, trainings, we're already doing some of that, and team building exercises. Then we put these as priority 2 projects, but again, that was just sort of internal. It's not to mean that they're not important. I think some of this is likely to change after we go through the deeper dive with the consultants, that maybe some of our 2s become 1s or vice versa. So there are provisions in the rules about property cleanups. Again, all of these things are really, they're trying to target disproportionate populations or low-income households in particular. The certified food manager training, that idea was that we saw more or have seen more foodborne illness, and believe that it is associated with practices that kind of fell apart during COVID, or people didn't have enough staff to spread out those duties, and that it would be, one of the ideas is to provide training and or some grants to support these kinds of activities so that we can build them back up.
Is that training for our personnel or for restaurant staff?
Restaurant staff.
Got it.
Okay, and then repairing, replacing sewer and well, and addressing any corrective action. So, as I mentioned, I think what we're trying to get from you all is just some final direction on if conceptually you're on board with these kinds of projects, or if there's any you want excluded, anything you want us to hold off on, any other concerns you have. But as part of that approval process, if Bronner Group says, no to high risk, then we're going to want to either redefine that project or rethink it entirely and potentially bring back another idea. But instead of having to come every single time with every project, because we're going to have to do that at the county level. We're going to have a budget for every project and a well thought out plan. So wanting to find out how you all want us to navigate with you so that we can push these through on the county side and get going. Because all of this, we really have about 1.5 years to get everything obligated.
I have a question.
Oh.
On your clinical lab upgrade, you want to
The certified for the water testing?
yeah.
Well, Ohio's not too far from us.
So would that include testing for in the feces for polio, COVID, like they are doing in some cities, more proactively?
Patty?
I heard you going.
do you want to respond to Julia in terms of the expansion of the lab and what it will test for?
Our water laboratory, we don't test for wastewater constituents. We test for potable water and surface water. So what this would allow us to do is go beyond the bacteriological, and so we do some chemical screens, but this would allow us to actually do some quantifications and things like that, and then meet our program standards in those areas. So we're not proposing to expand into the wastewater analysis at this point.
I'm really interested by Juliana's comment though, because I've read about that, like they knew spikes were coming based on wastewater assessment and analysis. Does anybody around here do that?
Yeah, we do, but there are some,
There's 4 municipalities participating with their wastewater treatment plants in a project in cooperation with the state health department.
Really?
And they're done on a routine basis.
and we get reports and we share those reports.
So I have a question about the restaurant that you said, if you go back to maybe 1 or 2. Yes, it's a repair and replace sewer well. How do you, define that for me?
So I think what we're thinking is that, I think we initially called it grants, but I think it would be either a cost sharing or based on a sliding fee scale.
Okay.
Support people who, because these are very expensive systems to
Right.
replace. The idea is we want everybody to have access to clean.
How do restaurant owners know that they have access to it?
Oh, sorry, so are you talking about the well, or are we talking about the food manager?
No, I'm
training?
talking about the replace, sewer.
Yeah, that's not directed at
Okay.
restaurant owners.
Okay.
That would be private septic and sewer.
Gotcha.
I'm sorry, private septic and well.
Okay.
I have a question. I don't know, would we qualify for one of these grants insofar as, I believe it was last year, we gave restaurant owners a break on their licensure because,
I think the fees went up this year, didn't they?
No, they haven't gone up in years.
So I think that, if I understand, I know you haven't finished asking your question, but I think that's where the county
Check.
determines a revenue loss or revenue replacement and can ask for whatever that difference was.
okay.
But that doesn't necessarily come back, I don't think, into our budget. So we're not gonna see these things in our budget. They have a whole other place for it. It's just our ability to access these dollars and implement the projects.
But that would qualify for
I
these
believe that would
For the
qualify.
funds.
Yeah, for the county, I agree.
Yeah.
Just thinking way outside the box, would there be any benefit to having one of those mobile UV units that go around and would be used in the office space when you have staff, but, you know, if there's something like COVID going around again, that you could set it, let it go, and everyone's office would be sterilized, you know, kind of thing. You know, like what you have you
Yeah,
seen
those
this? You know what I'm
UV
talking
things,
about?
yeah.
Yeah, you're talking about for use here and.
Oh, it's some like machine?
Yeah, it
it's a-
sits on the floor and it
it's a
goes
thing you-
around.
It's like a little robot.
Yeah,
I don't-
that is not what I had in my head, so I don't know what I
I don't know how well they work.
So you can do like ventilation and things that would clean the air. So that's an allowable use, I think, to purchase that kind of equipment and have it
I don't know.
in.
Yeah, we
Susan,
have,
do you know of any incidences where you've seen it used or anything like
Like
that?
some schools were using those during COVID.
Who was?
Some schools.
we had
And
one
most
installed
hospitals know
in
ours use
each
it.
of our 5 ambulances. And it's a device that goes on the ceiling, and you can turn it on fan mode where the light is always on and it's purifying that air. But then when you're done, you hit a button and it has to be sealed. It has a motion detector, the doors have to stay closed, and then the shroud opens and it bathes the entire area in UV light for
light.
5 or 10 minutes or whatever, and eradicates everything. It is fairly common. I have one installed in my HVAC system at home. That said, I think that's not a bad idea.
I mean, the
just for
mobile
all sort
ones
of
are
infection.
pretty compact and tall. You see the guys like go through the sweepers in the store, it's kind of just like that. I don't know how much they are, but,
You just like set on a desk and you walk
well,
out.
no,
for
this one
10
is
minutes,
like person tall. You just set it in the hallway, leave the doors open, and it'll go around and do everything.
Oh, it drives.
Yeah, here, if you look
Yeah, they
at,
have
it's a
mobile
robot,
ones
it's
That
a,
they use in the hospitals.
it's a,
Don't make a mistake and open the door while it's.
no, it looks like, well, there's a couple different styles. Like, there's one like that, but then
Oh, I
there's
see.
other ones that are like,
Yeah. I don't think they've looked at that, but. I
that
bet
look
it's
like,
not.
But I think that is something that we potentially
Could.
could look at.
I
Especially for your mobile clinic, if you were lucky enough to get a mobile clinic.
Oh, like on the,
Like
Yeah, that
who's
you could
got a
add on to
manual
it. This
system.
one, I was just thinking because staff is so, exposed to everybody that it just would give some sense of security that at least, it's kind of clean when you come to work.
I think there's a lot of great ideas, and there's very interesting things, but I wanted to make sure I understand, you're asking us for direction on what we see here, or what we want to see coming back from you?
it could be both. So like, this was the grouping of projects that we were proposing to move forward.
Mhm.
It's not a guarantee, but if there's something missing or something else you'd like us to explore, because it could be that one of these projects is not going to be eligible, or they say it's too high risk, and that may then open the door for, then we'll want to rethink, I think, how we are using those dollars. The other thing is that some of the larger expenses, we don't have a solid, we've been working with facilities and trying to get costs, but those costs are going to continuously shift, so we don't really know. We only have estimates.
Can you go back to the screen with all the projects?
Yep. This? Well, the dollar amounts.
I'm wondering for the environmental health, when you said property cleanup, that doesn't include like our recycling programs, does it?
No, although Patty did have a solid waste idea on there. I put that onto the, and I probably failed to put it on here, but was in our number 2.
Okay.
Because I don't think that is as a solid fit with the COVID requirements as some of the other things. It's not that it's not a good idea, it is a good idea. But we are going to have to prove the relationship.
Alright. Well,
Or have a justification and a rationale. Now,
right, I can see just because you couldn't have a lot of the events and that there's like accumulation. I mean, every event we've had is, been
Yeah.
full in capacity in the
I
back.
mean, we can certainly ask that question.
So I'm just, that just something that, the public really likes and, if we can get more funding for that.
And also, separate back to the UV thing, there's also the UV hand thing, so you don't have to put the pumps, people don't have to touch them. They go into like animal control, just sitting there, they put their hands in there and
I'm curious how much of these projects were, you and I talked about previously, just informally, about administrative wants, or like divisional director and above wants versus staff, and we've talked to staff. And you've said we've had multiple meetings now with staff. How many of these things were things that staff said, or were these primarily suggestions from staff or from directors?
I think it's a combination. So we had one staff person who runs, for example, the diabetes prevention and screening program that we have. That program is scheduled to run out of money,
Mhm.
right? So this would be a way, and we know that like those disparities did increase.
That's huge, yeah.
So that was an idea. There were some others that, Ann, do you want to?
We did have 4 different staff meetings, both over in Crystal Lake and here in Woodstock, so that everybody had an opportunity to attend. There would be one in the morning, one in the afternoon, one in the morning, one in the afternoon on different days that they knew in advance. So we had some pretty good turnout in some of them. Other ones, they were smaller, but very good conversations. They were about an hour and a half, 2 hours. People brought forward all of their ideas. As Melissa alluded to, diabetes, everything under the sun on, more pay, basically, more training. What can we do to be more cohesive as a team? What are we gonna do in the future if COVID happens again? The storage issues, those were all brought up by
Mhm.
staff as well. From the ER team, the EPI team, some data software that they would like to see upgraded so they can keep tabs on COVID and other pandemic diseases. So a lot of different things came out of those, and they were very, very good conversations.
And we didn't give them a list of anything that had already been
They
proposed.
came with their own
Yeah.
ideas.
Okay. One thing I'm impressed by on this is all of it really is mission it's like how to serve more. And I kind of expected, and one thing I'd asked about was like, how can we help you, like,
We'll do our jobs better.
Enjoy your jobs better, right?
But
Like,
some of
do you
this
need more
technology
space here?
upgrades-
Do you?
lowers some of that stress, right?
That's great,
Because
right. But I was kind of expecting
Yeah.
someone to say like, you know, during COVID, I didn't eat out as much, I wanted to bring food, and we didn't have a refrigerator big enough, or something like, you know, like something like I hadn't even thought of, something that would come out, or
We did have a request for a puppy, but that was.
approved.
A request for what?
Or something like,
Puppy?
mental health.
hey, during a pandemic, we had limited space and we were very close to each other, and
Well, so that's
was
part
that
of.
was that a thing?
No, so that did come up. So that's part of conceptualizing what can we do within the Crystal Lake facility, for example,
Okay,
because there's
cool.
more cramping there. But again, like, we have to be real specific
Mhm.
about what we can do, and that's a very expensive
Right.
undertaking. So I think that would be the next step, is to flesh that out for the Bronner Group, to say, we want to space people out, and then we're gonna have to give them specifications.
Okay. All right, so are you looking for us for which ones we specifically?
Unless there's anything you just say, I don't like that idea, because we can move forward and explore all of these ideas right now,
I think they're all great.
and then let the next step play out where the Bronner Group gives us feedback, and go from there. So then we would just continuously tailor till we get down to, I guess, as specific as possible. And then we could bring that back one more time and say, this is their feedback, right? To you all, or to the board, however you know, the full board. This is their feedback, and this is how we'd like to move forward so that we can begin rolling these out. I mean, we've already taken a couple of steps further, like the lab and the storage, right? Because we need more information. The only way to get more information is to take it to the next potential step, to get more specific on costs. Because facilities can only go so far without having an understanding from like an architect. What is it gonna?
Can we look at the next page again? I just want to look through 'em.
Was there anything that, like, you did not put on the list that, like, just missed the cutoff on this
I
list?
wouldn't say it missed the cutoff, but like, for example, one was vision and hearing equipment request. But anything like that, we sent back through the division directors to talk with their staff and just get clarification, and then determine, yeah, it's needed or it's not needed, and then we either kept it or took it off. So that's one that didn't make the cut.
Okay.
And there could be other ideas, again, as we go through, but I think we want to start with this, try to move these forward and make some changes.
Anybody have strong feelings
No,
for
I
in
like the-
particular or against?
I like the fact that a lot of it is keeping in mind that there may be a new pandemic or a new health
Yeah.
emergency. And so the planning is for not only right now, but for in the future when this happens again. For example, the drive-through PPE pickup.
Well, and also, do we make a drive-through permanent vaccination clinic or something, right? You know, it just,
Right.
I think things like that are possible, but there's a finite amount of money.
Right.
Well, the other
And it may
thing,
not be feasible to like modify the building in a way that we would like to see it modified.
so like, when we do, shooting tournaments, the, like, big ones, a mobile trailer comes in, and you could park it, and like, just like a mobile office, and move it to county, different areas in the county, rather than just a little bus, you can have a whole trailer pulled by a pickup truck, but.
Well, you know, that's a good question. I don't know. I think we're pretty well set up now for most people to be able to, okay, many, maybe not most. I haven't actually added up the numbers. You know, during COVID, IT really flexed its muscle, figured out, okay, we gotta go remote. We have a lot of technology now that allows people to work from home so we can keep them safe. Some of those direct services just can't be done
Right.
remotely, but we figured out a way, you know, obviously staff safety is a priority. You know, reducing the possibility of people getting ill is a priority. And I think those things are very expensive, and then it's like, where do we put it? Because we did explore that. I feel like we looked into that early on about having mobile offices out in the parking lot. And there was It was expensive, and then there was lots of turf over the parking lot.
Yeah.
Well, this is not like,
I can
it's
see
not
that.
like, it's not like a semi, it's just like a large trailer.
Call them mobiles.
And it has stairs going on one end, so when we
I
go
think
in,
that's what
when
we-
we go in and register, we walk up the step, we go the stairs,
Yeah.
go in this way, and then go out that way.
And I think that's what we looked at. But so anyway,
Okay.
I'm not saying it's not a good
Yeah.
idea, or it might not be something we need in the future, but it may not be something we need to have permanently.
Mhm.
And if there was another pandemic and there was funds to help, that could be something that we potentially look at again for like mobile office space to spread people out for a temporary.
No, I was
Okay.
thinking if you were gonna provide community services, you'd say for the week of something,
Oh, park
this
it
is our
here.
office, we're gonna be here doing vaccinations.
Would
that
it be
kind of
easier to
thing.
mobilize like local clinics in that sense, rather than putting on stuff up, like picking up clinics that are they're already open that can offer those services, and if it's there
I
more.
mean, I
than-
think we used Walgreens and then our own spaces that we had in the county. Who else was?
No,
doing
I'm just
that?
saying, like,
Other-
I mean,
the county did it for vaccinations.
But for IDPH, for what I knew, that they were picking clinics like their locals, for instance, like close to Dundee Crown School, I remember they found a clinic and they decided like, you know, you can come and get vaccinations here, and I think they got that thing done within a week just because it was easier for the kids who were getting tested. And in the beginning, I remember that school were very strict about who were coming in. They were actually had those thermometers in the front. They would scan you every time, and even if you had like a spike with even one, they would send you that way.
Are you asking, so like we did do vaccination clinics all over the county.
No, I know. I'm saying you did,
It popped
but
up.
as NCDH. But I'm saying the clinics that were already in existence, that were already had clients, or they were closer to communities that were more accessible. Were we not able to mobilize them with your
Oh,
licensing?
some of those weren't even like, I don't even know, some services were closed.
Okay.
I mean, Susan might be able to speak to that more, but, you know,
Oh,
we tried to
just-
position ourselves before, you know, initially, pharmacies weren't able to vaccinate initially, right?
Right.
So all of that sort of rolled out over time,
Okay.
and the landscape changed as the pandemic.
Right, but
went
I'm saying
on.
for the future going, if we put in a plan in that sense, we won't have to wait for that long for that to happen in order to get that.
But there are
service.
still people who were homebound, still lack transportation, so something like a mobile clinic gives us a lot of flexibility to really target outreach. You know, it could be in a church parking lot, it could be in
Right.
certain census tracts or zip codes, you know, where we
Once a
know
month.
access is limited.
Are you talking about like a memorandum of understanding with these different clinics that in
Yeah.
the future we could
If
utilize their
anything happens, for
space?
instance, like if the MCD is not able to mobilize immediately, if something happens, that they're more busy, they have bigger things to worry about,
Yeah.
just for instance.
I
Well,
think-
we do have MOUs with different,
Yeah, I was kind of shocked during the pandemic how a lot of the system broke down.
No, the crazy
Yeah.
part was, I remember a lot of nurses who retired came back to work,
Yeah,
and they went back and
they
said
helped
that-
us.
Yeah, no, I'm just, well, there you go. I mean, and for what I know, that like there was people who were willing to come and help the doctors they were with certified that give vaccines. And I know that they just didn't have enough space because they were not certified enough, or they were not clean enough, or there were many other reasons, so.
Yeah, I think it's good. Anything that adds capacity.
I think then
It's
they
like a
all,
network of things that if you wanna come up with where you have like a certain certification that's required, you know.
well, we have the Medical Reserve Corps, we do have MOUs with certain organizations to do, you know, pods, that's dispensing, I mean, not to say that there's not always opportunity to try to
Well, yeah, I'm
expand
just
that
saying,
network.
especially like
and-
schools, like if there's like, if you wanna just send somebody for a random, you know, say, hey, just for a wellness check sort of thing. You can hire a clinic that can go do that for you rather than wasting county's time, and they can divert the data right back, saying, hey, this is what's going on, or close a clinic, you know, sort of thing.
I think that may be getting into a difference between private pay and county services also, and I'm not really
Right, yeah,
sure
I
what
mean,
that.
I mean, yeah,
overlap
that, we
is.
go further, just an idea.
Shit, I was gonna say, oh, for capacity, and Juliana mentioned, talking about the next pandemic. They might seem too far out, but I'd like to think some of these things consider the possibility of other, not necessarily pandemic, but other terrible events, like a shooting, right? A
Oh.
mass shooting,
Yeah.
a tornado,
Yeah.
some kind of natural disaster, something that would massively impact our community. We've been, knock on plastic, as far as I know, very fortunate that I can't think of, but it could be, so having stuff like PPE, like a lot of it, like, would that be of use? Would that, obviously vaccination equipment's not really gonna help in like maybe a tornado or something like that, but people are still gonna need health care. And I remember
Yeah.
at Katrina, I did 2 weeks down there and people couldn't get their meds. So that might be something for us. So if we have, I like the ideas of increasing capacity, storage for PPE, that's great.
Shots for
Helping employees
flooding and-
remote, awesome. Make their lives easier, especially if they're not feeling well, they don't wanna come into work, but they can do the job from home.
Right,
Cool,
yep.
great.
So we've already implemented a lot of those components. Not that we're not constantly trying to, find
Yeah.
additional ways to do that, because I think that's something we should always be iterating on, because that's the world we live in now.
Yeah, I think I hear from both committees the approval
Okay,
to
so.
pursue and,
Do you want us then, in terms of next steps, get that broader group, then bring it back before we sort of present a broader plan to the full board?
Yes.
I think see what they think about that
Okay.
list, and I think they're gonna approve all of those, frankly, just looking at the list.
Well, we
reading
now,
through
like
what
I
you-
said, we just got something that we can fill out. We put a spreadsheet together ourselves, but we'll go through this next process, project by project, get that to them, and then await their feedback. Okay.
Internal to the health department, has anybody spoken against this plan? From entry-level employee to most senior employee? Nobody's spoken against?
Nope.
Good. Good to hear.
Better for the community, I'm hoping that's why they're investing.
I mean, I'll
Yeah.
ask the division directors, I'm not aware of any negative feedback, but in case,
I mean, they makes their life easier and better too, so I don't think that would be, it's an idea of going into a different direction, but maybe a better resources, but that's all.
Yeah. Divisional directors, one at a time, everyone's in agreement? Yeah, okay.
The main priorities are all valid. They're, I find no fault in any of them. I'm very comfortable with the review process that's gonna take place between the consulting group, the federal government,
Mhm.
county finance, and county board, county administration, et cetera, that any programs, any expenditures is gonna be consistent with the intent of the ARP program. So I encourage you to move forward.
okay, fantastic.
God, you're so well spoken.
It's pretty quiet.
2 hours sleep.
I was gonna say, you're pretty quiet today. He reps it all.
Yeah.
That is the silence of the lambs.
But we're not done yet. We have two.
No, no.
Yep.
And there's no motion necessary on that? Do you want a motion to approve you? This is informal.
Yeah, we'll just take it to the next step and then we'll come back.
Okay. 3B, resolution adopting reclassification and title changes within the Department of Health departmental roster.
So this is within the Veterinary Public Health Division. We, Mary Ellen looked at her staffing. So previously we had their titles as assistant managers, but with some staffing changes, she's reorganized a little bit. We did send that through as a comprehensive position questionnaire, which goes to HR for them to review and score, and it came back as a 12. So we are proposing to make those title changes to manager. So from assistant manager, their titles would be changed to manager. One person already is at a 12 because that job had gone through the system previously. So it would be just changing one reclassification from a 9 to a 12, and changing both titles to manager position. One is going to be for internal operations, and so that's the kennel, the front office, and then the field operations is animal control officers. Anyone else in the field? Or is that?
No, that would be the two
Okay.
managers.
So any questions about?
Just the anticipated financial impact it's saying they will be absorbed because of turnover and or unfilled positions.
That's
but-
right, so it's about, Mary Ellen, I'm sorry, I did not bring that number, but I want to say it's like
That's
8,000.
what it's about that.
It's a pay,
6,000?
there's a pay bump there, right? So there will be an ongoing cost going forward.
Correct. In the
Okay.
new
But for
budget
this
year,
budget
yes.
period,
Right.
or for this budget year, we can absorb that within the savings from unfilled positions. So that's what that means. That's why it's not in here,
Yes. But going forward, there will be a budgetary increase, the 8,000.
but that will get absorbed naturally in the budgeting process through personnel costs.
So they're never gonna fill those jobs.
So it only matters like
But
in the current year.
Assuming we were at full authorized staff, in a perfect
Then-
world,
Then there
it
would
would be
be,
$8,000 extra.
right?
That's all I
And so
wanna
we
know.
would either have to ask the county for that additional 8, but
Okay.
in this situation, we're not asking them to adjust our budget.
Mhm.
We're simply asking them to make the changes,
Mhm.
and the increase in pay gets covered within the current budget.
Okay. Sounds good.
The new positions, manager positions, they report to the director? So they're the first level of supervision under your position?
Correct.
And there's 2, and only 2, isn't it?
Yeah, there used to be 3,
Uh-huh.
and now we have the administrative coordinator who runs the day-to-day, month-to-month stuff in the office, reporting to the internal operations person. So the internal operations person was our kennel operator,
Mhm.
but now there's some other functions that she's taking on that's sort of that internal operation type of things. And then the other are field operations. That person has already been there. That's one of the managers that was under me. So we sort of went from 3 to 2 to change some functions around to
Okay.
meet our needs.
Is this managerial position consistent with the other divisions? In other words, the employee that right below the directors in the environmental health and nursing.
No, they're all
administrative.
different, and that's due to those comprehensive position questionnaires and how they get scored within that Archer system. So it's similar in that you have the director and then you have people who report directly to the director, but it looks different in each division. And the titles are not the same.
Understood.
Because why would they be the same? Make it clear.
Those are bigger questions that I
From before our time.
can't answer.
Any questions, concerns? You looking for a motion?
Mr. Chairman, I move that we approve the resolution as presented, creating the position of manager, internal operations manager, field operations within the veterinary public health animal control division.
There's a-
Second.
Perfect. We have a second. Was Juliana?
Yep.
Mr. Markison?
Yes.
Ms. Borowski?
Yes.
Dr. Ansel?
Yes.
Mr. Galati?
Yeah.
Mr. Clark?
Yes.
Ms. Carmen?
Yes.
Ms. Gaffney?
I'm not in the
You're
committee.
not, okay.
Thank you.
Your ex officio. Okay, thank you. 3C, resolution authorizing changes to the Department of Health's fiscal year 2023 departmental roster.
Yes, so we are requesting the addition of another accounting assistant to help spread out the workload, help stabilize and provide more backup within our fiscal division operations area. It's not its own division. We've had a lot of turnover in fiscal, and even with 2 accounting assistants, the workload, every time there's a new grant, it's an increased workload. We now have, so we have somebody temporarily sitting in this position who was an intern for us, who's a billing specialist, so they have additional responsibilities because some of the billing has really, fallen off track as a result of not having somebody and with turnover. So this will help stabilize, we feel, our fiscal operations, and now we have hired for the fiscal, a permanent fiscal operations manager who will start on Monday. And so wanting to put this on ARPA, so we have a few years to say, okay, let's see if we actually need 3 people in this position, but for now, to spread out the workload, get everybody cross-trained, and just get this piece of our operation stabilized, we're requesting the addition.
I think last time I skipped the order, normally we should have a motion and a second and then discuss, right? I defer to Joe's. Yeah,
Yes, yes.
that's the look.
Yes, yes, you would.
Would anyone like to motion?
I'll move that we approve the resolution to create another administrative assistant in the accounting division department.
So motion on the table, is a second?
Second.
We have a second from Dr. Amsler. And discussion, questions, concerns?
So this position will be funded by the ARP, you said, right? Okay.
So then that gives us time, so if we decide at the end of ARPA,
Mhm.
or the, at the end of 2026, well, probably before that, because ARPA does require you for any positions to continuously sort of evaluate, do you still need them? See where we're at, and then if we need to keep a position, then we would go to the county and request an addition on the general fund, is basically what would happen.
So they're not, are they starting now, though?
So we have them slotted in as a temporary
Okay.
staff person, and we have money on the COVID crisis that we're using, but we want to make this a permanent,
Okay.
temporary permanent, not sure quite. So it's sunsets with ARPA.
Will you be posting this position for other individuals that might be interested?
No. Because, the billing piece is something that we have lacked. So actually, we did post, I think we did post the position. This person, because of the special skill set that they have with billing, is something that we have been lacking. And so with that addition, it really allows us to reach our capacity, we hope, and then recover some of those funds that we haven't been able to recover due to inability to do some of the billing components.
And Human Resources is okay with that?
Yeah. Mhm.
About finance?
In what way?
It sounds like, I know we've had some difficulties in this area previously. We've had a lot of turnover, as you mentioned. I've met a handful of them, and it seems like there's turnover. We've talked in previous to Mr. Busso, who is now
Boyso.
Boyso, who is now
Uh-huh.
now moved on. At one point we reached out for their assistance or their input or advice on some of those issues, and I was wondering if they had also.
No, so, they're aware of, because we have to write the resolution, so it goes through them to approve. So they didn't have any questions about it. It's, I think, an appropriate use, and operationally, I think we have to continuously be evaluating, like, where are our pain points and how do we plug those holes, and then we'll continuously evaluate, and then adjust. And maybe we would go down to 2 people and feel like that's good, 2 accounting assistants and an accounting manager, so long as everybody's trained. But once you lose one accounting assistant, like, it's not, you really can't keep up with the workload.
Will this individual have any responsibility for the bid documents and all that's going to be required for the ARPA?
That is
program?
probably going to go to the operations manager, the
Okay.
fiscal operations manager, internally,
Who starts Tuesday, you said?
Monday.
Monday.
And it's actually,
But
One of
that
our-
would also, that manager would assign it to employees that work for it.
so they'd have to
Correct?
work with either the division directors, to get that information, but to make sure we're meeting the deadlines, they would be providing backup documentation to the county for reporting. So we do that now with some of the things that have already been approved. They seek our documentation, we get it over to county fiscal, because they have a person at the county who's responsible for managing the ARPA for the county. But within the department, we would have that task managed by the fiscal operations manager.
Correct. Well, the point I'm trying to make is this is going to create an additional workload for
Right,
those individuals. And we are making changes now that's gonna help get this through.
yeah, and then again, like that grant that we don't have yet from the state, that's gonna be a 5-year grant. You know, that's an additional reporting process that we have to account for. So I think this is gonna help manage the workload, make sure we stay on top of things, we reduce errors, we get everybody cross-trained so that they can fill different functions when somebody has to be off. And we don't have the ability to really do that well now.
Any questions or discussion? Darlene?
Ms. Carmen?
Yes.
Dr. Ansel?
Yes.
Mr. Galati?
Yes.
Mr. Markison?
Yes.
Ms. Morowski?
Yes.
Mr. Clark?
Yes?
Okay, executive session, I don't think, is there a need for an executive session? Nope. I'll be looking for a motion to adjourn.
So moved.
I'll second it.
Wonderful. All in favor?
Aye.
Aye. Thank you all. Thank you, staff. Thanks for your time. Appreciate it.
It is very good.